Hello guys! Magandang araw sa inyong lahat at may bago na naman tayong video at ang video natin ngayon ay tungkol sa signs and symptoms of urinary problems. Guys, gusto ko lang i-share sa inyo dahil ang lahat ng nasa topic natin ngayon is naranasan ko noon. Kaya guys, panoorin nyo to para ma-aware din kayo kasi dati kahit na marami na akong nararamdaman, hindi ko lang talaga pinansin at akala ko mga konting problema lang sa katawan, pero yun, napunta sa malaking problema. Kaya guys, baka meron kayong iniindang sakit dyan or mga konting nararamdaman, sana panoorin nyo to at para ma-aware kayo ng maaga at habang maaga pa is maagapan na kung ano man yung mga symptoms na katulad nito ang nararamdaman nyo. So guys, please continue watching my video and please subscribe sa hindi pa nakapag-subscribe. And God bless everyone. Painful or burning sensation during urination. Painful urination or dysuria suggests an irritation or inflammation in the neck of the urinary bladder or the urethra, the small tubular structure that drains urine from the bladder. This is usually due to infection. Pain may also result when there is presence of stone in the urinary passages. Scanty, frequent urination and urgency. Quite a number of people urinate 4 to 6 times a day, more frequently at daytime. Some people normally urinate more frequently and in small amount. This is a symptom of decreased filling capacity of the bladder from its normal capacity of approximately 400 ml. Bloody urine. Bloody urine or hematuria is a sign that should not be ignored or taken for granted. It should be addressed seriously. This could be a result of disease such as cancer of the kidney or bladder, stones or calculi, and infection or acute glomerulonephritis. Some less common causes of hematuria include staghorn calculus, polycystic kidneys, solitary renal cyst, sickle cell disease, and hydronephrosis. Voiding during the night. Frequent emptying of the bladder at night, or otherwise called nocturia, may be a symptom of kidney disease. This happens when the functional cells lose their ability to concentrate urine. People who drink excessive amounts of fluids in the late evening will experience nocturia. Coffee and alcoholic beverages, because of their specific diuretic effect, often result to nocturia if consumed just before bedtime. This symptom may also be manifested in heart or liver failure. Urinary tenesmus or painful straining. Painful straining is associated with inflammation and swelling of the bladder caused by infection, stones, or tumors. In cases where the symptoms occur, the desire to void with straining is usually felt. Pain is produced by contraction of the inflamed bladder muscle. Flank pains. Flank pains are pain noted at the lower portion of the rib cage located at the back is usually related to kidney disease. The stretching of the renal capsule is probable cause. Inflammation or distension of the renal pelvis ureter causes pain in the flanks or left and right sides of the abdomen. During physical examination, the doctor determines the presence of inflammation by punching the flanks with the bottom of the fist. When pain is felt by the patient, there is a great possibility of kidney inflammation. Turbid or hazy urine. Hazy urine may be a result of infection or the presence of precipitated urates when urine is acidic, or the presence of precipitated phosphates when urine is alkaline. Edema. Edema is an accumulation of excessive water in the extracellular spaces. These are spaces outside or in between cells. It presents as facial puffiness, which is common in some specific kidney disease. It may also manifest as swelling of the lower extremities in the abdomen or bloating. This is a result of fluid that could not be returned to the circulation. This happens when the kidneys excrete large amount of albumin, a protein responsible for drawing water from the extracellular spaces back to the circulatory system. A good example is a kidney disease called nephrotic syndrome. Edema may also occur in liver or heart failure. High blood pressure. Anything that causes decreased blood flow to kidneys, or for example, kidney tumor, or anything that causes destruction of the filters, results in high blood pressure. Even if only one kidney has poor blood supply, it will cause the secretion of the large amounts of the enzyme renin, which leads to the formation of a substance called angiotensin II. Angiotensin II is responsible for constricting the blood vessels, thereby causing high blood pressure. Anemia. One of the important rules of the kidneys is to produce a hormone called erythropoietin. This hormone is responsible for stimulating the blood-producing tissues, or for example, bone marrow and liver, to produce more red blood cells. 80 to 90% of erythropoietin is formed in the kidneys, and the remainder is formed mainly in the liver. In a patient with chronic renal failure of severe degree, the kidneys cannot produce enough erythropoietin, which results in lesser production of new red blood cells, therefore causing anemia. Pallor and fatigue. Pallor is a natural paleness or absence of color in the skin as a result of anemia. When there is less functional red blood cells, hemoglobin, an oxygen carrier which gives the skin color, is also less distributed through the body. As each of our cells needs oxygen for good functioning, poor oxygen supply leads to easy exhaustion of the body cells. Thus, a person feels a loss of strength or endurance. Easy fatigability can also be a result of high concentration of waste products in the blood. Weight loss and malaise. Loss of weight is a combined result of fast metabolic rate, more sensible and insensible fluid loss, or as in fever, and loss of appetite during the course of an illness. When the body demands for more source of energy and less food is taken in, the kidneys begin to convert stored glycogen into glucose. When all glycogen stores are utilized, Fat deposit will replenish the need for energy. However, if illness lingers for some time and other sources of energy have been used, proteins from the muscles will be ultimately converted to energy. This causes the wasting appearance of a severely or terminally ill patient as seen in malignancy. Malaise is a vague feelings of bodily weakness or discomfort in either a beginning or ongoing illness. Fever and chills. Fever is an increase in body temperature above the normal range caused by the release of pyrogens from germs or bacteria or viruses or from the body tissues. After these pyrogens reach the hypothalamus and the brain, they will immediately cause the body to produce fever. Since blood temperature is less than the set point of hypothalamic temperature control, it will take several hours for the body to reach the same temperature. Chills then will be experienced. The cold skin is the result of vasoconstriction which causes the patient to shiver. Aside from infections, fever is also present in other kidney conditions such as cancer. Associated headache, nausea, and vomiting. When sufficient kidney function is lost, disturbance of other organs occurs, producing symptoms which are a result of uremia, a toxic condition where the blood accumulates byproducts of protein metabolism. These symptoms can be relieved or reversed by dialysis or kidney transplantation. Headache, nausea, and vomiting are non-specific signs and symptoms present not only in kidney problems, but also in some other diseases. Sometimes, no signs or symptoms are present. Most patients with gradual but progressive damage of kidney filters may have no symptoms in the early stage. When kidney function is greatly diminished or when the number of nephrons is reduced to 5 to 20%, only then will signs and symptoms appear. This may eventually lead to death if not intervened by dialysis or kidney transplantation. Chronic renal failure is often detected too late because of the late appearance of signs and symptoms. Think of these things. Having no outward manifestation of an illness doesn't always mean that one is healthy. The leading killers in our time are those that silently, gradually, and progressively encroach into our system that when any signs or symptoms starts cause a concern. An enormous damage has already been done. Therefore, having the right knowledge and practice about health gives us the highest chance of evading these preventable diseases. That's all for today's video, guys. Thank you for watching. Please don't forget to like and subscribe and click the notification bell para updated kayo for my new videos. God bless everyone. Bye-bye!